Welcome to Orthodontic Smiles, the podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontic Society.
Hi, my name's Dr. Brad Williams, and I've practiced orthodontics for over 35 years, and over those years, I've had some fantastic teachers like Dr. Bill Wyatt, Dr. Bob Garrity, Dr. Dave Jackson, and many, many more. And I'm honored now to be teaching orthodontics to a whole new generation of general and pediatric dentists. I want to personally invite you to enroll in one of my basic or intermediate hands-on courses through the American Orthodontic Society. We are committed to provide your entire staff the support and training you need to launch orthodontics in your pediatric or general dental practice. And to make the hands-on experience in my classes the best possible, I've partnered with an outstanding and very ethical company called OrthoArch to provide all the orthodontic supplies my students need. When my students start treating patients in their offices, they too will benefit as I have in partnering with OrthoArch for all their orthodontic supply needs. You can contact OrthoArch at www.orthoarch.com. See you in class.
Orthodontic Smiles Podcast will present a very unique production. From our research, this production is a first. In past presentations, we have interviewed luminaries in the field of orthodontics. They have talked about their cases and treatments. We have concentrated on every aspect of their treatment and their procedures. We have never focused on the patients they were treating. In collaboration with Dr. Leonard Carapezza, Orthodontic Smiles has interviewed a family, a mom, a dad, and 2 of 3 triplets Dr. Carapezza has treated. Dr. Carapezza's article on the treatment of these 3 young triplets is featured in the summer release of the Journal of the American Orthodontic Society. This podcast is being released in conjunction with this journal release. With this first-of-a-kind podcast, we feel that the future of podcasts of this type will only give us the ability to expand our knowledge of scientific articles. We will now have the ability to interview contributors and their patients about the treatments they have rendered. Orthodontic Smiles Podcast is proud to interview the triplets and the family that Dr. Carapezza treated. Welcome to Orthodontic Smiles. This is kind of a unique, I've got to say, the very first time we've ever done a podcast about an article that is being presented in the American Orthodontic Society Journal. It is unique in the fact that I think it gives us an opportunity to talk to the patient. We've never had that opportunity. We've never had the opportunity to talk to patients about treatments that have been done by some of our great practitioners in the American Orthodontic Society. And today we're going to be reviewing one of the articles that will be presented in conjunction with this podcast done by Dr. Leonard Carapezza. We all know who he is. We refer to him, at least I do, as the godfather of early treatment orthodontics, and I think this podcast will very succinctly pinpoint the fact that early treatment orthodontics is of benefit, especially in the treatment of Class 3 malocclusions. So today we're joined by Dr. Harold Pickens, Dr. Christine Hayes, and their 3 children, Elizabeth, John, who happens not to be with them today, but Claire is with us. And we'll have an opportunity today to talk about the treatment and why they sought out treatment from Dr. Carapezza and how the treatment went, because it was a long-lasting treatment. It started when these kids were 2.5 years old, and they're now in their late teens. And you can see that pictures that are in the article. So welcome, and thank you very much for being on Orthodontic Smiles to all of you.
Speaking for the group, thank you very much. This is Harold Pickens, and it's interesting to hear how Dr. Carapezza is known in your society. He's known to us as Dr. C.
That's we call him that as well. But he comes with a tremendous reputation, and I'm curious how you got to him when you first started treatment with the kids. Were you just members of his office, or were you sent specifically to him?
The mom is going to answer. I was in a triplet group, and I asked another mother about her dentist, and she highly recommended Dr. C to us as someone who was unfazed by multiples. And so we went for our first cleaning when the children were 2.5, and they did films, and he met with Harold and I and said, "How important are teeth to you?" And I said they were very important to us. And he said, "Well, you've got some malocclusion going on here." And we started down the path right away.
That's it. That's the next question I was going to ask, whether or not you were aware that the children had some issues, because Dr. Pickens does have a malocclusion, I understand, and you have a grandfather or a father that had a malocclusion as well.
Yeah, my grandfather, my maternal grandfather, and I as well. Though I these are things that only became apparent to me when I began learning about malocclusion from talking to Dr. C and then looking into it, in follow-up. I will say that in retrospect, I've experienced some of the, at least I'm told that the sort of protrusion of my jaw and all that at times can make me unintentionally seem like I'm, especially when I was younger, maybe coming across as stubborn, belligerent, that sort of thing. And when people read sort of facial expressions and all that. So in retrospect, I experienced some of that, but was unaware of it until this all came out.
Okay. So you've never really had any orthodontic treatment yourself?
None.
Okay.
But so we did recognize that John was going to need some orthodontic work. We had not recognized that the girls also had it to a lesser degree.
It was becoming more apparent even at that. It was beginning to become apparent even at that early age physically that he had it, but we didn't realize about the girls.
Yeah, that's very common. Boys express class 3 malocclusions much more strongly than girls do. That's why you rarely see girls that look like Jay Leno. But boys can, because they grow so long, they continue to grow way past when a girl would stop would be around menses, but boys continue growing up to 21, 22 years old. Mm-hmm. So they express the malocclusion more than girls do. So it obviously Dr. Carapezza saw the need for some orthodontics, and he started off by just expanding the upper jawbone. And give me your impressions of how was it expressed to you that treatment was going to be a long process?
He met with both Harold and I and explained how the process would go. We would start with the palate expander, and then they would go on to the braces, and that all children develop, at different rates, but he anticipated it would be a number of years, and that he would be with us throughout the entire process.
Well, let me get into another part of it. Was the financial part of this of any concern to you? And I ask that perhaps maybe it wouldn't be for yourselves, but for other people that might be listening.
Well, we're very lucky in that, given many of the benefits that that we ourselves, in terms of education and training and the support our parents and families gave us to have jobs and careers with good incomes. And much of this work is stuff that's not covered by dental insurance. But for both me and Christine, this was always a priority and not something that we gave a lot of concern or thought to in terms of spending the money on it.
Let me ask you this: did they all start treatment at the same time?
Yes.
Yeah. Yes.
So they basically all had expanders in at the same moment or the same day.
They're 20 now, so asking who got one when at 2 and
That was a long time ago, wasn't
exactly.
Yeah.
But I certainly recall that we had to try to get that little key in there and turn it, and they all did have it, roughly around, it might have been a week or two apart, but they were very close in time.
And they would have different challenges at different times, and we can get to it if it comes up. But their individual experiences would be variable.
Did they complain of pain?
Yes.
Initially, on the very start of the whole process.
Yes.
Yeah, that's also very common too, and a lot of us who do practice early treatment orthodontics and get started with kids at a very early age sometimes concerns the parents significantly because they're having to go home and put up with it. But it doesn't last long. It lasted 3-4 days probably, and then after that there wasn't any more pain, just a little bit of discomfort every now and then.
Well, we have a little bit of a dissenting view on that observation.
Okay, tell me about it.
Well, with this is Claire speaking. Hello.
Thank you.
With the palate expander in particular, we had palate expanders that had a key that you'd use and turn to expand the jawbone. With that device specifically, it would hurt every time the key was rotated, which was a process that lasted maybe 4 to 6 months before the braces were installed.
Or longer.
And did you have to turn it every day, Claire?
We were turning them, I think, every day, and every day that it was turned, it did hurt.
Okay. All right.
I don't think we were successful at every day, but I think we were shooting for, maybe every other.
Every time it was turned, there was pain.
Right, and there was challenge in learning. I don't think I ever became very adept at the key. I think it was Christine who did it most of the time, because depending on the kid, the actual practical aspects of getting the key into the mouth, into the kid, seeing the hole, turning it was a little bit challenging, but she got it done.
And you had to do it on all 3 of them.
Yes.
Right.
And see, I bet you by the end of it you became pretty proficient.
Again, that was a long time ago.
Yeah.
Okay, let's move on then. So we got that palate expanded, and we're progressing and getting the front teeth out in front of the lower ones, as Dr. Carapezza usually does. And then at that point, some of the baby teeth are starting to come out, at least in the front, and there needs to be the need for some orthodontics. So my understanding is that he started to put some brackets on the front teeth when they got a little bit older.
Sure.
We were 7 years old when we got our first set of braces on.
Okay. And how did you feel about that?
I was too young to know what braces were.
Okay.
I didn't know what they were. I just heard that this was going to help my mouth look better.
Did wearing braces bother you in school? You were pretty young then. Most kids in school don't have braces on, at least at your age.
I know. We were asked to floss after every meal, which we used to do during lunchtime recess at school, which was a challenge because 7-year-olds need to be supervised at all times. So flossing in the bathroom was
difficult.
A rarity among 7-year-olds?
Yeah.
Put it lightly.
I agree with you there. I don't think I've ever seen a 7-year-old purposely go to the bathroom and floss unless they were under duress by their parents. So it's strange. And back then we have so many new little tools to make flossing easy now, and you didn't have those tools back then. You were probably just doing it with a piece of string and your fingers. But nowadays we have these little floss sticks that make it so much easier for kids to floss.
It's hard to floss around the wires.
Right.
It is, and you have to do it. We try to teach each patient as we go through the treatments and what they're going to be wearing, but it is still difficult. So you were then in grade school at very young age, in the first and second grade, when you got your braces on. So tell me what happened as you progressed through into middle school and on.
Well, so I'm Elizabeth, and as we progressed into like middle school, we started to have elastic bands that we put on special like hooks on our braces to like, I'm not sure what the purpose of that was because I'm not a dentist, but we had those. I mean, there's a variable amount of wearing them. I did not wear them as often as I should have. And we had those, and then Claire got her braces off in 5th grade, and I got them off, I think, in 6th grade. But then we got them back on in 8th grade.
When all of your permanent teeth came in, now you were in full comprehensive treatment at that point.
I think I had all of my adult teeth when I was 9 years old.
Yeah. Girls would do that. And let me ask you this. Did you at any point in time, or any of the three of your siblings, have to wear a reverse pull face mask? And that is the appliance that goes on the outside of the face, and you wear rubber bands to the upper jaw.
John did.
Okay. And how long did he wear that?
Boy, we don't remember at this point, but it feels like it was.
I would say a couple of years.
Yeah.
A couple of years. Okay. All right. Yeah. Since boys are, like I said, express the malocclusion more than girls do, that Dr. Carapezza was jumping on the fact that he had to move that upper jaw forward, and that one appliance, although bizarre in the way it looks, works very well. So I'm glad he was able to get him both there. I was looking at the results of what Dr. Carapezza started with and how it ended, and he did a marvelous job. Very uniquely marvelous, and I might add, because I think he used some really neat techniques, some teeth having to be removed. I bet you didn't like that. Did that concern you at all, Claire?
The teeth removal didn't concern me. We had been getting teeth pulled for years since we got braces when we were 7 years old. They were pulling baby teeth to, I don't know if they're trying to make way for the adult teeth to grow in faster, but we had been getting teeth removed for years and years. I think I must have counted. It was like in the low teens at some point, the number of teeth I had removed. So to get 4 of my adult teeth removed, it didn't really faze me at the time.
Mom and Dad, did this concern you? Obviously, when we're starting to take out permanent teeth, that's usually a big concern from most parents.
Well, 2 things come to mind. One is I remember at one visit, I think these were baby teeth. John had 7 teeth removed. And I said, I'm worried I'm going to find a dead tooth fairy on your pillow in the morning to make light of it. But later, Dr. C explained that to make room for the way he needed to move the teeth to have the appearance to so there is not an appearance of the class 3, and he explained it with diagrams, and it was very clear, and so we were comfortable with it.
Okay, good. Because it was a little different. Go ahead. I'm sorry.
A little bit aside. Let me interrupt, but you might ask, how were we able to have the confidence of all of this?
Well, that's what I was getting at. When you start taking permanent teeth out of your kids.
So one of the things that I would maybe encourage for somebody to do an interesting piece on for your journal and all that, I'd send somebody out to Dr. C's office and operation, because I'm sure there are many in your college that are like this, but it's truly impressive. He's converted a home in Wayland, Mass, into an office, and without getting into too much detail about all the different aspects of it, it's beautifully designed for kids to get their dental care. And everything from all the little kid dental station seats to the way it's decorated to entertainment. And I know a lot of stuff is sort of in vogue probably now, but just every detail is designed, I think, around making it a good experience for kids. And related to that, and that is reflected in the way that he and his team practice. Every single detail they are just very, very, very careful about. And so I think for me, at least, part of it was that, you when you get into whatever kind of, whether it's healthcare or something else, and you see you're in a situation where complicated issues are being dealt with thoroughly, effectively, every little detail is being cared for, that instills in you a certain amount of confidence. The other piece is that, Dr. C has a large, really sort of converted, almost sort of a hall next to his clinical area, where he does a lot of teaching of Tufts dental students, and
a mini auditorium.
It's like a mini auditorium, and at the end of that, he has his desk and his computers and his screens, and that at many of these stages, at key stages, he makes separate appointments on a different day when he does this exclusively, and he's not seeing patients clinically, where he sits down with parents, and as the kids got older, occasionally with a kid and all that, and goes through and shows you x-rays and diagrams and pictures and drawings and calculations, and very thoroughly explains things and pros, cons, choices, options, that sort of thing. So that he's always been so good about that I feel like we've felt very comfortable with following his guidance.
And at times he would have John come in and be a demo to his students.
Yeah, he also is good about using. He's brought John in to show a clinical live example to some of his students as well. And Claire as well.
Yeah. Well, whether you know it or not, he has been teaching for over 50 years, and he's taught probably hundreds of thousands of people over the years in many countries and throughout the United States. So when I say that he is the godfather of early treatment orthodontics, I'm not kidding. He really is, and we all look up to him as a person that we can learn from, and the ability to be able to teach it is another thing. Some practitioners can practice and do a great job, but the ability to get the information back to a student is even more important, and he does a wonderful job of that. So give me an idea. Did this ever, during the course of this treatment, I'm curious of the kids, because it's not often that you have parents that are so into this that they allow their children to go through so many years of orthodontics. So I'm curious if at any time during the growth and development of the kids, did they have a difficult time with self-esteem or difficulty in their teen years dealing with so lengthy a process?
To the parents, we were unaware of any problems. When we were talking earlier about the podcast today, I was hearing how, they were frustrated with the length of time they were in braces, but they never said anything to us about it. And I think I had braces at the age of 19, and so I had them in college. And so I would say, oh, gee, I recall when I would get, the new bands that I couldn't eat for a few days. And so I think them hearing that I had braces in college probably didn't sound positive. And so, and that I was able to understand that they couldn't eat, and we would make mashed potatoes or something for dinner, or that there was, or yogurt, something easy, on the teeth. So, but I really never did hear any complaints to my recollection.
Girls, do you feel like any problems? Did you feel like anyone ever gave you a hard time about having braces or?
This is Claire. I never felt self-conscious about having braces. I know there was a period of time in which I never knew when I was going to get my braces off, but I trusted Dr. C that he would know when was the right time. So I didn't know, and I was like, it's okay. It was I knew I had a routine. I had my braces, and I figured it would be worth it.
Tell them the story about the aisle. Tell them. It's cute.
Oh, one time I went in, we went in every 3 weeks or so for checks. And one time I asked him, when am I going to get my braces off? And he said that he would be walking me down the aisle at my wedding with my braces on.
You know what they say, you set the expectations low so that you can only do better, right?
And at that point,
Exactly.
I stopped asking when I would get my braces off.
That's it. You never asked him again after that.
Oh.
That's definitely Dr. C. He'll give you an answer that you didn't want to hear. That's great. It's wonderful to be able to talk with you all. When you're talking, I'm listening to the same experiences that I have with my patients. The same words that they use, the same feelings of I'm apprehensive, but I'm comfortable. The idea of when am I getting my braces off, and how difficult it is to floss, and how long is this going to take, and why does it so many years? I hear the same exact things from my patients as you have expressed today, and it goes so nicely with the article that he wrote about the treatment that he provided for your whole family. And let's face it, when you're doing treatment like this, it is the whole family. It's not just the kids. It's the parents that have to deal with it, parents that have to understand it, the parents that give their permission, and the parents that have to pay for it. So it all through the years, I mean, you should have some real great gratification of how nice a job he did on such a difficult type of orthodontic case. When a Class 3 malocclusions walk in the door to most of us, that's the case you say to yourself, oh, shucks, I wish they hadn't come here, because it is such a difficult case to treat. And he did such a marvelous job on all three of the kids. It's kind of unique to have triplets come in and have the same problem and have to deal with it in radically different ways. So I'd like to say thank you very much for coming on to Orthodontic Similes Podcast. It's unique that I had the opportunity to interview you all as a family, and I think it will go over very, very well with our production. So thank you so much, the Pickens family, and Dr. Hayes. I appreciate you very much coming on the Orthodontic Similes Podcast.
Well, it's been our pleasure, and our willingness to do this is a manifestation of how great it has been to be with Dr. C and his staff for all these years, and we've always appreciated everything that they've done for us. So if there's any way it's our way of paying it back a little bit, then no problem.
With innovation, quality, patient comfort, and efficiency as their goal, Henry Schein Orthodontics has once again achieved a new and exciting breakthrough in aligner therapy, introducing a clearly different aligner system, a comprehensive aesthetic solution for adults and teens. The SLX Clear Aligner System is uniquely clear, provides an excellent fit, and offers numerous treatment and workflow efficiencies. With over 50,000 patients treated with this innovative aligner technology, doctors and patients can be confident in the SLX aligner performance for a full range of minor, moderate, and comprehensive treatments. Jumpstart your SLX cases with the Carrier Motion Appliance to provide the most efficient and aesthetic treatment solution available. For more information, contact your Henry Schein representative or email aligners@henryschein.com. This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.